Okay, Chris, so I'm going to hand over to you to introduce our final speaker.
Thanks very much, Sue. So our final speaker of what's been a great morning so far is Gareth Presch. Gareth's founder and CEO of the World Health Innovation Summit, and he's going to talk to us around moving from disease management to good health and well-being, which I think will summarise our morning fantastically. So delighted to have you here, Gareth, and over to you, sir.
It's a pleasure. Thanks, Chris, for the introduction. And I just want to thank Sue and also Ben for introducing me to Sue for this opportunity to speak to us this morning and talk about prevention, moving from disease management to well-being. And that's very much the focus of the UN Sustainable Development Goals and SDG 3. And just a little bit of background on myself, just so that you understand where I'm coming from. I worked in the Irish Health Service, so you can probably tell by my accent, I'm originally from Dublin in Ireland. I was the Chief Officer of the National Haemophilia Council in Ireland, and you'll probably recall the debacle in the 70s and 80s with contaminated blood products. Well, that was the area that I specialised in with Blood Policy Division in the Department of Health. And then I also worked in the NHS in eHealth Cumbria for about 18 months. And the reason I moved to Cumbria in the UK is because of my family. My wife is originally from Carlisle in Cumbria, and we have two young girls. So that's what brought me to the UK. So let's begin. Let's start thinking differently. What a title. I think that's fantastic. Because we do need to think differently if we look what's happened over the last 18 months, but also moving from why, as Simon Sinek always says, what's your why, focus on that. But I think those days are past, and now it needs to be how, and how do we make those implementations? How do we scale up the ideas? Very much the future that we will see emerging over the next couple of years will be around ideas. Who will create the ideas? How do we then match those ideas, as in with the finance? And then how do we scale those ideas? How do we invest in the companies that are going to be sustainable in the future? And healthcare has a huge role to play in that. And that's really where the World Health Innovation Summit platform comes up. You'll probably, we're all aware of the giants, the conglomerates in the world, the massive corporations of the Googles, the Facebooks of the world. They are technology-driven digital platforms that have amassed enormous amount of money. And this is how we look at, well, what will be the future sustainable platforms? And this is an opportunity for healthcare to actually step to the fore. That's part of the discussion this morning and part of the presentation. So let's begin anyway. So look, we're well aware of the sickness model, and that's almost touching in line with why. We're well aware of all the stats and all the data, why we need change. We currently have 93,000 vacancies in the NHS, for example. This is well publicized. I don't really need to go through that. I think we're almost sick of hearing about the problems that we have. We know why we need change, but the key is, how do we drive that change, and how do we create that value? So we need to focus on this, the health factors, a salutogenic approach, which is well-being, very much in line with the SDG 3, good health and well-being. These are the factors that will drive the change. This is where value creation is the opportunity for the health service as well, and where we can create new and meaningful jobs in the future. How do we do that? Well, this is a very simplistic picture, and it will give you a very good idea of what from my vision perspective, and why I started the World Health Innovation Summit, and how to strengthen the existing health service, take pressure off the service as well. It's around engaging at mass population level. And we've seen that with COVID-19, we need to get the communication effective. And how do we do that in cities? Part of my role with the SDGs is to work in cities around the world as part of the UN GSII Foundation, but also working with UN Habitat and partners around the world to implement the SDGs in 1,000 cities. It's to bring good health and well-being into the mass population. And you'll see here, this is an example. This was our WIS Nottingham event, where you can see effectively that's your GP practice at scale. You can then promote good health and well-being at a very large level across the population and improve the health and well-being. At the same time, you're creating enormous value for Nottingham in this case, because by bringing 5,000 people into the local economy, you're creating opportunities, and that's an economic opportunity. You're also offsetting disease, as in because you're engaging with the population at a very mass level, so you can alleviate the pressures in terms of disease occurring in the future by giving sound advice now. And that's really what we're looking at here, is prevention at scale. And how do we do that? There's also an added bonus that when we do collectively work together and we share our knowledge and creativity together, and we get smart. Our social interactions are a huge opportunity of investment, and they're how we learn, and that's knowledge management. That's one of the areas as well that the health service can pick up on, because from its intellectual capital perspective, the health service is very rich in that space. And it's actually an area that is, shall we say, abused, because you'll be quite aware of all these free events that many corporations host for the health service. But really what they're doing is sucking intellectual capital from the system to improve their services that they sell to the health service. So these are sort of things that we need to think about and also think differently about. So WIS is a preventative healthcare platform which empowers people to improve their health and well-being by facilitating community engagement. How do we do this? Well, this really comes down to partnerships, SDG 17. How do we actually scale these opportunities up? I spent about 20 years working in the health service. I've been working at the World Health Innovation Summit as the founder over the last 7 years. I've been working with the UNGSII Foundation for about 3 years. And it's all about partnerships and trust. Trust is the most important thing, being open and transparent. And then building those partnerships with trusted partners so you can scale that work. Part of my work has been, I've been very fortunate to be asked to work with Pope Francis and the COVID-19 Vatican Commission, and to provide advice to our partners and our stakeholders within the UN system. How did that come about? Well, that's through Roland Schatz, who heard me present the work that we done with World Health Innovation Summit in Geneva in 2018, and asked me to lead on SDG 3 Good Health and Wellbeing in the 25+5 Cities program, which is an accelerator program where we bring the knowledge and the finance to the cities to help them scale and implement the SDGs. But that program has been expanded. So we have these international agencies that we work with within the UN system, and then we can actually share our knowledge using their platforms as well, so that we're all working together. So part of that work with the Vatican and COVID-19, the commission set up the Pope set up a commission looking to the future. I'm part of that group 2, and we make recommendations on how we can get to that future. So that's part of our work at the moment. Looking at the model of healthcare and what do we want to have, a patient-centered system, how do we engage within that structure of community? And how do we reach out? How do hospital services become more patient-centered? Well, we really need to look at the funding mechanisms as well. And where is the real value? Where does it come from? It actually comes from the community. We need to almost invert our system. We don't have enough staff. By 2030, we'll be 18 million staff short. And how do we accelerate community jobs? Well, we need to invest in the community, but you'll get a higher return in the community, because that's where the real opportunity is, by curtailing disease. The situation that we have at the moment, you're well aware, we're hemorrhaging staff at the moment. I mean, US has lost about 500,000 since the pandemic hit. We have a real squeeze on the health system at the moment. 28 million elective surgeries have been delayed globally. So these are going to cause enormous problems. You can alleviate these pressures by working in the community, but you have to do that by smart investment. That's very much where MSK can come in as well. So that brings us on to like our kind of model, our kind of framework. How could that work with different services? How do you engage? How do you provide those programs in the community using the platform? You start with children, with kids, you start with, mental health, well-being, offsetting these costs before they actually develop. With at work, stress management in the workplace, with seniors, falls prevention, quality of life and loneliness, but also looking at the knowledge opportunities and the wisdom that can be shared from a senior's perspective. There's enormous wisdom in the system, and we don't really capitalize on that. Then we have communities and engagement, but one of the most important factors as well is climate, which is where you look at green and the environmental impact. There is no health without water, for example. We have serious challenges ahead in that front. Then if we look at social prescribing and the opportunities in 2020, just at the end of the year, we launched just coming into January 2021, we launched the Global Social Prescribing Alliance between ourselves, National Academy of Social Prescribing in the UK, UNGSII Foundation, and the World Health Organization, basically to accelerate this change into social prescribing, to bring in stakeholders from all over the world. We have about 25 countries we're currently talking to. And on Wednesday, I will meet with the Democratic Republic of Congo, their health ministry, to discuss how they can come on board. Africa is a huge opportunity to almost revolutionize healthcare. You may think that Africa has poor healthcare. Absolutely, it does. But Africa has a lot of minerals and commodities that it can use to accelerate change and also prepare for the future, not build the infrastructure that we have built and make the mistakes that we have made. So there's huge opportunity there, same in the likes of South America and same in Asia, in these emerging nations. So that's part of the advice that we're given to these nations on how you can build sustainable healthcare models. You can also do that in current systems, by the way. You can develop new ways of working within the hospital sector. So how do we reach prevention at scale? And you can see we really need to take this mass event activities to a new level. And how do we bring in the arts, for example? Because we know we don't really have to talk about the evidence because the evidence is there. We know that the music and the arts is extremely good for our health and well-being. It provides us with an opportunity there to engage in that wider community, should we say, to engage on that stage. And offset disease before it develops. We know that this works. I think the children's aspect, in terms of the children's programs that we've developed, have a huge role to play. And then, of course, you can digitize those and scale them. I just wanted to touch on the why, and we touched on this earlier. This was a presentation I gave in 2019 on Bucharest on One Health and the opportunities. And lo and behold, before COVID hit us, we've been warned, we had been forewarned about the situation, and we are being forewarned about climate change. And this is where the opportunity comes from the COP in terms of what we can do as a community and as health professionals in the health service. And the wider health community can do is actually make that change happen. And how do we do that? Well, you recall just 46 million healthcare professionals signed a declaration going to COP, and they wanted to see this change happen. Well, in order to make that change happen, you need to put finance into it. Why don't those individuals and those organizations look at where their pension funds are spent rather than being spent in tech or in tobacco in some cases? Why not invest in the sustainable development goals? And I'll explain why we should do that and the opportunities. In terms of the evidence, as I spoke about, what is the evidence, in terms of our programs and what we did initially in prototyping in Cumbria and Carlisle, it was very clear and it's very evident, everyone knows that if you these low-cost interventions in schools, for example, have huge impact in terms of their societal return, offsetting mental health illness, for years to come. And they have a massive economic return, but at the same time, they stem the flow of what is coming in to the system. And we need to also recognize that flow will always be there because, and that's why we need to consolidate some of our services, to centers of excellence because of the staff situation. And we need to have that open and honest, frank discussion with the communities to say, look, in order to get the best outcomes, we have to centralize these services. And again, this comes down to navigating the system. In terms of data, in terms of data collection, in terms of platforms of the future, digital is going to be huge. It's a massive opportunity. You see that with some of the tech companies who have tried to move into healthcare. The main reason why they failed is because I think transparency has been a huge problem. But with the SDGs, we have this enormous opportunity to bring that forward. It's some of the work we're engaged in at the moment actually is to digitize a lot of these programs, to scale them up, but then also to provide that openness and transparency, that mechanism to ensure that the data captured is done ethically and safe, and also to ensure that we are completely transparent with everyone. And I think that's part of the values of what we stand for. In terms of the financing, and this is where it gets really interesting because this is where we come into pension funds and we come into philanthropic donors and we come into private investment, and we all want to know where the finance comes from. And it's really important to understand where the finance comes from. And it's a question that we need to ask. And because as a health professional, as a manager, when I worked in the NHS and I worked in the Irish Health Service, one of the things I never really understood or paid any attention to was where my pension fund was being spent. And I had no idea. All I did was at the end of the month, enjoyed getting my paycheck. I had no conscience whatsoever of where my money was going. And it was only really when I was introduced to the SDGs and introduced to the SCR 500 and looking at who puts money where and how is that relevant to today's, shall we say, environment. And it's really, really important. So what we've been working on with the foundation is monitoring that across all the top S&P top 500 companies in the world. And we started this back in the Millennium Development Goals when Kofi Annan and Michael Muller were involved, UN Director Generals, and Roland Schatz and his team were monitoring what these top 500 companies were spending their money on in terms of investment. Was it related to SDG 1, no poverty? Was it related to good health and well-being? And then what they also did, it wasn't just a case of what they said in the media, it was what they were signing off in their annual reports. So they produced the SCR 500 with Al Berkeley, the former president of NASDAQ, to see who was investing smartly and wisely. But most importantly, what they wanted to find out was if you invested in these companies that do good, do you get a good return? And the answer is yes, you do. That gave them the opportunity to then bring this forward in terms of the SDG program, where they now know when they bring the finance in terms of setting up a fund, they can then invest in these companies that are ethically safe and sound, and then get a return, which then they can seed fund other projects. And it's really clever stuff. And they've been doing this for the last 3 or 4 years, building up the evidence, shall we say. We have our 5th year annual report will come out in January at the Davos event. It's our lab, not the World Economic Forum, because we have a separate lab there. But it's up around 53% over 4 years. That's a huge cumulative return, which if you just for example, you have £1 billion, there's 1.5 billion back over the course of the fund. That's a cumulative return. So these are massive opportunities. And if you look at what governments can do around mobilizing their cash flows into these special vehicles, and this is what we're doing at in terms of financing the cities around the world, because be under no illusion, there's plenty of cash and around there. We need projects. That's again part of my role with the foundation, is to identify the unicorns of the future in terms of ethics and opportunity. And all of this stuff, by the way, is available online, and we've published it. You can get it off our websites. I should have just to mention, we have already started in Brasov. So we have our first hub, which you'll see there, and working with these partners, FAO and WHO, and actually working with Global Social Prescribing Alliance, where we've identified a number of projects that we're going to invest into the city. And that is a substantial investment. That then will be the catalyst in order to get sustainability going towards the 2030 agenda. Now, how do we move this into a different space again, and where do we bring all this together in terms of thinking differently and prevention, and also the mining sector, and what does that have to do with healthcare? Well, it really and mobilizing the capital in Africa, for example. So later today, we'll make a public announcement at 1 o'clock. It's a recording from last week's event where Roland Schatz announced the Kinshasa process, which is similar to the Kimberley process, which you are probably familiar with, which is the blood diamonds, where we have worked really hard with partners, government partners all over the world, from Japan and Germany, UAE, to ensure a sustainable mining framework is put in place. So that's what we're looking at. And you might say, well, what's that got to do with healthcare? Well, it has everything to do with healthcare for the DRC, because at the moment, there's illegal mining. They don't get any tax from the mines, and they don't get any return. So they can't finance the hospitals, for example. So when they begin to bring this in, this structure comes in, then we can use the finance raised through the selling of the commodities. They can then engage in the community to develop the services and the finance flows. So I hope that makes sense. And I can take questions on that later. And then this is what we started. So last week when Roland was in Kinshasa, we were on the outskirts, engaging with the communities and ensuring that the children in Europe, we're helping the children in Africa, for example. We're bridging those gaps, and we're making sure. When Roland went there a couple of months ago, we asked, the girls and the families, what do they need? And again, you'll recognize as well that this has huge influence on their health and well-being. It's enormously beneficial for them. And that's part of our WIS Kids. And we also have a huge youth academic platform that we're developing in the DRC. We have about 40,000 students ready to go. And this will bring in an insurance program as well to support their families and themselves to finance their own health insurance. So these are the sort of things that we're bringing forward. In terms of investment, in terms of the other engagement opportunities that we have and the work that we're doing around gender equality, last week I was speaking with investors, and I think this is one of the most exciting things that I've experienced is being able to bridge into the financial sector and have those conversations, because I think that's really important. We've never really had those conversations, and being able to do that is very important, because those who are investing, they make a lot of money, but they also make a lot of mistakes, and a lot of money is lost because they invest in the wrong companies. And I think it's important for the health sector to have that bridge into the financial sector and advise on that aspect of what is a good investment, what is a sound investment. For example, you pop up cancer clinics in rural areas with high cost equipment and whatever, but they're lying vacant because there's no staff there. I mean, that makes no sense. I mean, these are the sort of things that we need to be able to articulate with the investors and with public bodies, with the government agencies. These conversations need to be had, and so money is not wasted, and then we can put the right investment into the people ultimately. So we're doing some of that work with the Health Innovation and Entrepreneurs in Europe. That's a EIT fund, which is quite a large one. We just started that engagement process. And then also in terms of what we're doing from the platform's perspective, we're beginning thought leadership sessions where we can openly share this knowledge with general population using digital means. We have one of our sessions on the 16 days of activism around gender equality this Friday, and these are the sort of engagement forums that we can showcase, similar to today. Being able to share this platform with everyone here digitally is just fantastic. Finally, just in terms of thinking differently and what we're doing to support MSK is, as I mentioned at the start, I was very fortunate to meet Ben many years ago when I first launched the World Health Innovation Summit. We had a coffee in London and we had a discussion around what we could do. And we have an expert group around MSK, and I'm absolutely delighted to be working with everyone on this group. And what we intend to do is bring forward best practice and projects that we can add to the UNGSII pipeline, to our pipeline, in terms of where we can invest and smartly invest in the future. That's pretty much everything from me. I'm going to stop the share and I'll answer questions, because actually I can see some questions in the chat line, in the chat box. So let me just go and just see if I can pick up these questions. So if I'm right,
you're happy to take them, I'll read them out for you. You can
please,
just think about them if you want. Yeah. So one from Rob Yeldham: how do we get greater recognition from decision makers outside of health of the positive health and well-being impacts of having access to natural spaces?
Well, brilliant question. So we work very closely, as you've seen all the agencies we're working with. And one of the areas is we work with Mafalda Girate at the Climate Investment Fund, for example, who are investing in those natural spaces. Some of our programs, for example, we work with NHS England or James Sanderson at National Academy of Social Prescribing. And we're very much at the forefront now of engaging in those wider discussions and embracing those discussions as well, because even if we look at water, for example, the oceans, we need to have these discussions. Microplastics, these are all affecting our health and well-being. So we are actually at that stage. But how do we do that? We need to ask more questions. We need to knock on doors. We need to be a little bit fearless. We need to challenge. And I think that's the only way we can make progress on this.
And in terms of kind of getting the public to welcome the kind of broad level of engagement with big corporations, the question is around, how do we do that without people fearing privatization of the NHS and corporatization, if you like?
So I think this is a great question, and I think this is something we really need to discuss. So it's really important to understand the financial structure within the NHS and how it works, and also the corporate structure in terms of how the financial flow works. So first and foremost, when you work in the NHS, your pension fund finances the private sector. Okay, so you need to be aware of that. So it's a continuous cycle. So you're not actually privatizing anything, if you get me, because the money is actually just in a circular economy. So that's part of the reason, and we need to have that conversation with people so that they understand. So I hope that answers the question. We do want, the free of access point is an incredible, universal health coverage. I'm all for that, but we need to understand how it all works, how it's financed. There's nothing for free. For example, you have to pay for it. I think in the UK, they put £200 billion into the NHS and social care services. That's the taxpayers funding, you know what I mean? But think about what I just spoke about with the fund. Okay. So if you put that 200 billion into that fund, you can get 53% return on that. So there's your huge return. There's your opportunity. So these are the sort of things that we need to have these conversations so that people can understand. And we need that wider engagement with communities so people can understand how health services are financed and what improvements we can make.
Do you think we're being somewhat naive in how we kind of perceive things in this country? I mean, that's because this is much more of a corporate global discussion, which is great. And I think maybe there is that kind of naivety and rose-tinted glasses around the NHS. Do you think that's a challenge for us? Just in terms of the culture?
I think there's a couple of things here that we really need to look at, because if you look at the emerging nations, and I just spoke with the DRC, for example, and they don't wait around. Like there's people, because they have huge need. Do you know what I'm saying? So the need drives that innovation, but that will also come to the NHS because, for example, we have 93,000 staff short. Okay. So that's a huge need. And across the social care sector, there's huge vacancies. And so you need to come up with new and innovative ways to, service those needs. Otherwise, we're going to have mass problems. We're already having it. I had a friend of mine who's an ICU nurse came up at the weekend, and she was telling me about, some of the patients that are presenting now, 30-year-olds presenting with cancers because they've left them too long because of the COVID situation. So these are the sort of things that are going to come to the fore that will drive the change. But I think we also need to begin to start to say, how do we mobilize quicker? Because one of the learnings from COVID is that we have to move quickly, and one of the learnings as well from COVID-19 is that the vaccination program has worked really well. Okay, how has that worked? Because we've went out into the community and we've engaged in the community. So there's learnings there, but it's really important that we learn from the mistakes we've made and not just continuously make those mistakes, because if we keep doing that, we're going to have problems. I hope that answers it.
Yeah, and it kind of leads along a little bit in terms of that engagement too. There's a question from Heather around deprivation and poor health and wellbeing in towns and not just cities. Is the SDG just city, or is it city region based?
It's everywhere. And so when we started the program, initially it was just the 25+5 cities. So we were basically looking for front runners and lighthouses, those who were willing to adopt change quickly, and those who were willing to run with it and go accelerate the process. But we've learned that, we have to have that multi-sector approach and also bring in the regions. So some of the areas we're talking to at the moment is regional areas. I live in Cumbria. I have been talking to Cumbrian MPs and other officials for many years, explaining the opportunities in terms of bringing investment into the area, because you're talking about huge numbers of opportunities around investment. I think this is also an understanding. We have to have this understanding of how do you attract investment? And that's really around attitude. That's around your mindset. Because when the investors come, they want to see that there is an appetite there, that there's a willingness to change, so these are huge factors. If I take my own region, for example, just in terms of the coal, we've had this debate around the coal mine and whatever, there's really you have to understand how the global markets work and also how investments work. If you are highlighting that you're going to invest in coal, for example, you may get a short-term win, but you will actually drive other investment away. So this is a conversation that needs to be had locally as well. And so if you go down that road, you will turn off the investment the other way.
That's fantastic. I'm conscious of time, and I'm sure we could talk for a long time, Gareth. I'm going to call this session to a close for 12:10, but I'd just like to say thank you for a fantastic, definitely thinking differently approach, and give us lots of food for thought. So thank you to you, sir.
And any further questions, happy to take them, online.
Okay, brilliant. Thank you, Gareth.